Well, hello everybody. Thank you for coming this evening. We're right at 6:30. We've got a great show for you, great discussions. CMS is here to share with you some information. I'd like to thank you all for taking time out of your very, very busy schedules. In fact, even thank you guys even more for being here at a very I would say inconvenient time for family. This happens to be Passover, Holy Week. Today's Holy Thursday, tomorrow's Good Friday. When we were dreaming up this event, we were really struggling on where to schedule it. And everybody's calendar just happened to be open this week, and it wasn't until we got well into the planning that we realized why. So I apologize for doing that, but from the standpoint of the healthcare community, what's happening with healthcare reform, all the governmental regulations, everything coming to a head, this actually couldn't be a better time for us to have this event, so thank you for joining us today. Bathrooms out here on the front door, but if you would please, we're going to actually close these front doors, and if you would exit out the back and come around, that would not disturb what's going on up front with the panel members and the questions. We'd much appreciate that. As well, parking, if you have your ticket, it will be validated at the bell stand downstairs. If you'll just take that to them, tell them you were part of this event, they will validate that for 3 hours of parking. If we stay long, which we have this place until 9 o'clock this evening, which would be a good thing if our questions lasted that long, you might have to fork out a few extra bucks for more than 3 hours of parking. Lost my place. Oh, surveys. Along with the packets that you guys received, you have a survey, and it's a survey in which I think you will find out will be very important for you guys to provide some feedback, write some notes on it, and give us feedback at the end and drop them off at the desk. This is a kickoff event. This is not a one-time event. It's an event for us as a collaborative, and we'll talk more about what that collaborative is, but we need your input on what type of educations and resources you guys need as we're journeying through this transformation of healthcare. So that survey is very important, especially your comments. We value those, and we're going to build our program around that. So please take the time to complete that during the event today. There's a problem here within the Kansas City area, and it's different in each of the areas around the country with EMR adoption, usage of the CMS programs of e-prescribing, the quality initiatives, and understanding of the information that is being thrown at all of our physicians and practice managers right now. And because of that, it's almost somewhat of what I would call a paralysis analysis going on in the Kansas City area right now. Our EMR adoption rates are somewhere south of 50%, and that's being generous. We have some practices that are being very successful with EMR adoption and some that are not. We have some practices that don't know which way to turn, who to get the resources from, or who to even listen to for the information that's being presented to them, and whether or not it's got some sort of bias to it. So we recognize that problem. Here, your local HIMSS HOA chapter, which is the Heart of America Health Information Management Systems Society, typically works with the hospital systems, decided to reach out to the physician community and the professional providers in this area. So we have the professional associations all working together to bring this program together, such as the Greater Kansas City Medical Managers Association, the Wyandotte Johnson County Medical Society, the Kansas Medical Society, the Missouri Society. We also have the Kansas City Quality and Improvement Consortium, who is a contractor for the Missouri REC. We have the Kansas REC here as well, and that's the regional extension centers. And the source of all the true information is actually CMS. And so CMS Region 7 is here this evening to outline just the facts. Here are some of the programs that are timely and important. Here are their timelines. And we're going to have that presentation at the first part of this program. After they finish their program, we're going to take a little break, and we're going to bring up 6 physicians in your community here who are at varying stages of EMR adoption. They've had lots of experience with bumps in the roads as well as successes, and each one of them have gone about it in different ways. And so what we'd like to do is ask them a few questions about what would they do differently, what can they suggest to the rest of the physician community, and then also hear from you in the audience what kinds of questions and burning thoughts and concerns do you have, and how we as a Kansas City community can kind of push the envelope here and start adopting electronic medical records so that your practices can be successful in the new healthcare environment. So, without further ado, I'd like to introduce our CMS group. And attending here today with CMS, make sure I get all the names right. Neil Tho, who is it Tho or Thou? I always get that wrong. Yeah. There we go. He's our Deputy Regional Administrator here for CMS. Annette, oh gosh, Kusamal? Kosmal, there we go. All right. Ruth Parker and Darcy Jakopek. Close enough, all right. So we're going to go ahead and get started, bring CMS up here, go through their presentation, take a break, and please help yourself to drinks and food at any time.